Hi, I'm sitting with Dr. Gio Espinosa from New York University Langone Medical Center. His specialty is in holistic urology. And today we're going to talk about how he helps men dealing with side effects from androgen deprivation therapy. So welcome once again, Dr. Espinosa.
Hey there, Daryl. Thank you so much. Awesome and a pleasure to be here with you.
Okay. So men with androgen deprivation therapy, what are the things they're concerned about and how can you help them?
Well, let's start with this. So this is a conversation I had today with a patient, not yet on androgen deprivation therapy, but on his way. Typically, I see numerous types of patients, right? One of them is, Dr. Gio, I don't want any of these treatments. What should I do? I don't want any conventional treatments. All I want to do is holistic. Sometimes what I have to do, quite honestly, is kind of encourage them to seek out a conventional treatment because that's what's actually good for them. So in this particular case, he had a prostatectomy 3 months ago. Now his PSA is 10.0. He's saying, I'm only going to use your natural protocols and that's it. And that part of that is because, his wife died from cancer. So he has all these horrific images of his wife going through chemo and just dying, going through the mill with medical treatments and dying from it anyway. The other part is because he just, it was hard enough for him to do a prostatectomy, which he did 3 months ago. Now he's saying, well, do I have to do something else? That makes no sense. I always start the conversation with every good practitioner needs to acknowledge that they're biased, number one. So how many times have you heard, Daryl, in one of your meetings, well, every surgeon wants to do surgery or every radiation oncologist just wants to do radiation, right? Mm-hmm. So there's this feeling amongst patients that that every practitioner is biased towards what they do. That is absolutely true. Every practitioner is biased, and I am no different. I firmly believe in lifestyle and natural approaches to be amazing medicine. If you do a lot of the right things, whether it's the food you eat, exercise, certain dietary supplements, good quality sleep, that is real medicine. That is real good medicine. But I have to manage my biases just like anybody else, right? What if you do need something like ADT or hormone therapy? Well, that's what I said to this patient today. I said, look, I need to manage my biases. Yes, your PSA is now 10 and ADT, is what you should do. Oh, but I heard and read that it's horrific. The side effects, I'm going to lose my hair. I'm going to become incontinent. No, you don't really become incontinent from this. So I had to kind of reframe it to him and give him some, give him some truth, if you will, as to what happens when you do androgen deprivation therapy. So the first thing is, when I have a patient in my office, we have this conversation. Oftentimes they're already on ADT and it's like they want to minimize the side effects. All right, so let's just say they do ADT, then what? What can I do to help them further? There's two things that I do, I think, and I hopefully that I think that I do well. Number one is I want to be able to give them a lifestyle, a natural integrative approach that also has anti-cancer properties. In our last few conversations, Daryl, we spoke about this whole idea of this creating a microenvironment that's hostile to cancer cells. And you do that through lifestyle medicine. You do that through food, when to eat, what to eat, exercise, about 3 to 6 hours a week with moderate to high intensity. You do that with good quality sleep. Most nights, you don't have to have great quality sleep. My sleep score on an Oura ring, so I measured my sleep on an Oura ring, was actually pretty bad last night. It was like a 67. That's bad. The day before I had an 85, which is good. So you don't need to have great sleep every night, but but most nights you should attempt to have the best sleep you can. So good quality sleep and targeted, judicious use of dietary supplements. That's how you create a microenvironment that's hostile to cancer cells. So I try to do that with these approaches, along with when patients are on hormone therapy. The other thing I'm trying to do is also to minimize side effects from the ADT. I have to say that I've managed and I've hundreds of patients on ADT and hormone therapy, and I'm happy to say that most of them do extremely well. Well, they oftentimes ask, what do you consider to be extremely well? Extremely well. Well, number one, they're alive long term, 10, 12 years later. Number two, they have great quality of life, right? Quality of life is great. The things that I'm most concerned with in men and ADT is metabolic syndrome. That's when a patient has, for example, multiple things going on that increases their risk of cardiovascular disease. They have hypertension, their blood pressure is high, their waist size is too big, their cholesterol levels are too high, their blood sugar levels are too high. When you have any one of these combinations, that's considered metabolic syndrome, and that increases your risk of mortality from heart disease and things like that. So I try to manage that very well. Number two is bone health, right? So we know that you need testosterone to have strong bones. And with this approach, you minimize the osteosporosis, which is weakening of the bones, or osteopenia, which is a precursor to osteosporosis. So you minimize that significantly. Cognition, right? So this brain fog that sort of happens with testosterone, we try to minimize that as well. My patients still work on hormone therapy. They still are functional. They're still active. They're still doing amazing things. There are two things that I have not figured out, and one of them I'm getting closer to figuring out how to help. One is hot flashes and night sweats that they do experience. And I could tell you that black cohosh, this is a herb, a botanical that's used for women with menopause, actually works with men with ADT. I've seen that clinically. It's never been studied in men with on ADT, but it's been studied extensively in women with menopause to show that it works. It works very well. Then the question is, how does it work? Does it work by does it have an estrogenic effect, and that's how it helps women? No, it doesn't have an estrogenic effect. Actually, there's no estrogenic compounds in black cohosh. It works in the brain and the hypothalamus and where in the temperature center of the brain. Not to be overly geeky to your audience and overly scientific here, but it works in the brain like it works in women. So it works very well. So black cohosh actually works very well in minimizing hot flashes and night sweats. Acupuncture, it's been studied extensively, actually, for hot flashes and night sweats. So acupuncture works very well. And the other thing is low libido and sexual dysfunction. That doesn't get better. The reason why it doesn't get better is two reasons. Number one is because you need some testosterone to get an erection. And number two, you need testosterone to even have a desire to be intimate or to have intercourse. That goes away. And that just doesn't come back. The few patients that I know that are on hormone therapy and that are sexually active, they're sort of willing it. They're not really into it, but they're kind of forcing their way because, I don't know, they're newly married or their wife is younger or whatever, or they really want to be intimate with their wife. And satisfy their wife or their partner. It doesn't always have to be just a wife. So the sexual component of it is a little bit more difficult.
So let's stop for a second and just ask around. So when you say black cohosh or acupuncture improves or fixes hot flashes, are you saying it just eliminates hot flashes? Or reduces the wetness? What does it do? Go on.
Sorry, reduces the amount of episodes of these hot flashes or night sweats up to 50%. Black cohosh, to be honest with you, Daryl, I've kind of been playing around with for the last couple of years. So I don't have, and I'm one of the few that's doing that. I've been resistant because in the world of botanicals and herbal medicine, there's some herbs that have been pigeonholed to be good only for men. Saw palmetto as an example, right? Saw palmetto is known as a prostate herb, right? Of course. Meanwhile, it's been used for centuries for women who have urinary problems, right? So, and black cohosh has been used in women with menopause, never in men. And I sort of, for some silly reason, never really looked into it until a couple of years ago. So I'm still playing around with black cohosh, but what I can say at this moment in time is that, and this is, well, whenever this is going to be released, let's say 2021, about 250 milligrams once or twice a day really works very well. I would say about 50% of the times, along with acupuncture, it's about 50% of the times, just less episode. Is it cured? Does it cure night sweats? No, or at least not yet, or at least not in my experience. I'm experimenting with it. My goal is always to hit a home run with my patients, and it's a lofty goal often, but that's my focus.
So the idea of taking something that's botanical, but has some effect in the brain. When you said that earlier, it sort of sent a chill up my spine to my brain. It like,
but not night sweats. You don't get night sweats from that, from what I just said.
Not yet, no.
Cold sweats.
Well, I mean, I will shiver with the idea that I would be taking something to fix, someone would suggest taking something to repair or fix something, reduce the number of night sweat episodes or hot flashes that I might have. But at the same time, am I basically messing with my brain?
No, you're not messing negatively with your brain chemistry, or at least I don't think so. Mm-hmm. The other thing is that I'm using a bunch of other things, botanical wise, herbal wise, that improve brain function. Typically, and that helps with brain function with men while they're undergoing ADT, right? So the answer is no, or at least not that I know of. And I've been using these, I've been a naturopathic doctor for close to 20 years, and I've been using herbs for 25 years. And these botanical doctors and herbal medicine doctors have been using these herbs for hundreds of years. So we have some idea of how it works, and there is most of the things that I prescribe is evidence based, and so there's the side effect profile is minimal, and the upside is significant. And as it relates to men on hormone therapy, I tell you that I've been monitoring these men for 12, 13 years, and some of them have been monitored for about 12, 13 years. And you would not know or think that they have anything going on, or that they're a hormone therapy. They're just doing phenomenally well, with the exception of course, sexuality, like I mentioned before. So I'll let you ask some questions, because I could keep going for a while. Daryl, you let me know.
Tell me what the 3 top, side effects that people want to address with your care, and also what's the least common side effect that you've come across around ADT?
The 3 things that people want to the 3 main adverse events or side effects that people want to prevent is metabolic syndrome, cognitive decline or brain memory or memory dysfunction, and osteosporosis. Mm-hmm. Those are the big 3, and those you can manage significantly well with proper use of natural or integrative approaches. No question in my mind. You want to know the least side effects from ADT?
Yeah. What are the outliers that it could well be many more men are experiencing but don't understand that they're related to their hormone therapy?
Well, once men are on hormone therapy, they almost relate everything, even if there is no correlation. So, in terms of what they feel and symptoms would be extreme fatigue, which I address as well. I think most men on ADT do experience some fatigue based compared to their baseline before they were on ADT, but for some men, they experience an extraordinary amount of fatigue. And I think that I'm not sure that it's always associated with ADT or some other thing, adrenal fatigue, which is their adrenal glands on top of their kidneys just kind of are exhausted from stress or something else. So their extreme fatigue seems to be wrongly associated with hormone therapy in some cases. That's what I find.
Yeah, and there's an emotional component that aggravates fatigue or incites fatigue. Certainly the classic depression and anxiety sort of weigh in on a person. As you mentioned earlier, deficits in sleep and such. By the way, maybe you should try not sleeping with that ring and see how your sleep works. Based on a Heisenberg principle, an observed effect may be changed by, how you measure it. But the idea of sleep is absolutely critical to all phases of all aspects of health. I certainly noticed that in myself, and I imagine everyone listening to this knows that they've had good days and bad days based on the night before.
Not sleeping enough for, let's talk, I do most of my work with men. So let's just kind of stick with that gender for a second. Not sleeping enough, it's wrongly considered in some scenarios a badge of honor. You're working harder and you're sleeping less. You're burning, you're burning the candle on both sides of the candle, like the saying goes, something like that. That's a badge of honor. There's a guy that I follow his name is Jocko Willink. He's an ex-Navy SEAL, and he's like a self-development type of guy. I think he does great work, and his thing is about discipline, the importance of discipline. It's good work. But he prides himself a little bit into, I don't sleep much. I don't need that much sleep. I don't require that much sleep. So he gets up at 4 o'clock in the morning to work out and things like that. Yeah. I think that's a horrific message. Now, it could be that it does work for him, and it does work for maybe 1% of the population. But for most of us, if we don't get enough sleep, bad things happen, including our cognition declines significantly. We don't detox our central nervous system. So many things. Our immune system it's weakened. So many things, right? Melatonin is a powerful anti-cancer agent. I'm going to repeat that. Melatonin, which is a hormone secreted by the pineal gland when everything is dark and there's no light, and normally when you're sleeping, is a powerful anti-cancer agent. Is a powerful immunostimulating agent. Not that long ago, the president of the United States was diagnosed with COVID-19, and he was given 3 things. Well, he was given more than 3 things, but 3 natural things: vitamin D, zinc, and melatonin. Melatonin is very powerful. Now, I do recommend it in supplement form for some of my patients, but the bottom line is you get enough of it, or you should get a lot of it from sleep at night in a very dark environment. So very powerful. So sleep is very important. There's no question. There's a lot of research on it, and there's a good book called Why We Sleep out there that is excellent, that I just published a couple of years ago. So I want to hone in on that point a little bit, just because, again, I see it seems like is undervalued amongst men, and it's something that needs to be prioritized.
Yeah, and good that you mentioned a darkened environment. I think the people, we discount the idea that complete darkness aids sleep, in dramatic ways. I mean, I've tested that on myself. There's a room darkening curtain over, even though this isn't a bedroom, but we have room darkening curtains throughout our house. And it's like, what a difference that makes, quiet and darkness. It's almost as if it relieves headaches magically.
100%. Now, there's a caveat component to this. Most men, let's just say our age, although you might be just a little bit more senior than I am, Daryl, I think, get up at night to urinate. The fear is that if it's too dark, then you can trip, fall, and really hurt yourself. So people have night lights and things like that.
Yeah.
And I would say you have to have a night light if you do get up and urinate. Hopefully you can fix that problem, but you need to have a night light. And oftentimes they go to the bathroom, they turn on the light. Once you turn on the light, there's no melatonin production. That tells the pineal gland to stop making melatonin. And then once you start turning everything off again, then the process starts over again. With night lights, there might be some melatonin production still, even though there's some light in the room. The darker the room, the more melatonin you can produce, because melatonin responds to light in the environment. So again, I think melatonin is a great nutrient to take in supplementation. Some people do have developed some weird dreams from it, I've noticed. I'm not sure what the deal is with that. But all in all, and then some people do wake up a little bit groggy, almost like if they had a couple of drinks the night before. So I don't know what the deal is with that either. I measure it. I have all kinds of measuring devices, including a Fitbit and Oura Ring. So I'm my own guinea pig. I try different things and see what the results are. So if you see me in the front cover of the New York News one day as what happened with Dr. Gio, then I made a wrong experiment. That was
right. But your data survives. So
my data, and that's all that matters.
Right. So let's talk about things that are BS and people should avoid, or there's just overwhelming chatter about, but zero evidence to support.
It's a good question and a good idea. Let me just say one more other thing before we continue to that, Daryl.
Okay.
Most people will say, okay, you have to exercise. The most important type of exercise is strength training and weight resistance, particularly for those on hormone therapy. Period. End of story. You could play tennis and you could do all these things, and that's great. I want you to do that. But you need to push and pull some weight. That's what's going to stress the muscles, that then is going to stress the bones. And by stressing the bones, and then the recovering stage is how you strengthen bones. That's how calcium goes into the bone. So you can take all the calcium you want, and it could be toxic if it's not utilized properly by the body, right? So calcium has been shown to harden arteries and things like that. Of course, you need some calcium. But if you don't exercise, particularly weight-resistant exercise, it just stays in the bloodstream and causes more problem than it does good. So not only exercise, weight-resistant exercise 3 times a week, it's what's required for men on hormone therapy. Very important point.
Mm-hmm. Very good. So things that people should avoid, no matter what they read or hear.
The internet.
Okay.
It doesn't matter that I say that, because they're still going to go to the internet and read things. So I'm pretty much done with even saying that. But here's why. There's a lot of confirmation bias. This patient that I have today, all he wanted to hear from me is how horrific hormone therapy is. Mm-hmm. That's why, because he went on the internet and he saw that you develop urinary incontinence, which is, if it's true, I've never seen it, that you lose your hair. He thinks this is just regular chemo, which is not true. He thinks that you become debilitated. Not true in most cases. So you got to avoid the internet. Most people that do well on hormone therapy don't go back to the internet and say, hey guys, I'm doing great. I'm on Lupron shot every 3 months, and I'm taking Casodex daily, and I'm doing fantastic. They don't do that. People that are having good results don't go back to the internet and report that. Only people that are disgruntled and not doing well from their treatment, they're the ones that go and say how they feel. So avoid reading the internet, reading information from the internet. So that's number one. Number two, let's see. Avoid excess consumption of calcium. So what's good for the bones? Calcium, right? So these types of things are linked into our brains, and the doctor is saying, hey, you need more, get a calcium supplement. Not true, not true. Yes, calcium is important, but calcium is the least important thing. If, like I said before, if you're not exercising, calcium is not going where it needs to go. And too much calcium is hardens the arteries, and too much calcium with with low vitamin D actually worsens prostate cancer. This is based on research. You saw this a couple of years ago, that calcium increased the risk of prostate cancer. Well, there's some truth to that. So I don't really recommend calcium. I recommend other things for bone health that is not calcium, because I think, quite honestly, calcium is the least important nutrient necessary. You get enough of it from food, and plus you should be eating the right foods anyway. That has a decent amount of calcium. These are, many vegetables and things like almonds have a lot of calcium. So you should get everything from that. Again, weight resistant exercise and other things. So I think one of the things they need to either avoid or not take too much of. So if a little bit is good, more is not better. Calcium is one of those.
Anything else?
There are
obviously, cyanide, obviously you avoid things like that.
Yeah, avoid cyanide for sure, and hemlock.
Right.
The other thing is, I get patients that are runners. So they do endurance athlete. They're endurance athletes. I love it, because I want you to be an athlete forever. I want to be an athlete forever. So I love that. Running, so real runners run, I don't know, they run 30 miles a week, 40, 50 miles a week. That causes muscle wasting, because now your body's kind of using muscles for energy when you run long, a lot of marathons and things. You need muscle on hormone therapy. So again, the way you gain muscle and keep your bones strong and keep your body strong, all things considered, is through weight resistant exercise. Very, very, you got to push and pull some weight. So I would avoid excess running. You could run a couple of miles a day, no problem. But if you are a marathon runner, you need to be super careful. And you really need to counter that with some weight resistant exercise. So those are the big three: the internet, excess calcium, and excess endurance activities like running.
Right. Or bike riding, anything. It's not just
anything. Yeah. Triathlons and, so on.
Okay. You mentioned vitamin D. There are different types. What type were you referring to?
Vitamin D3 is the type that you want to get. Vitamin D3, roughly about 5,000 units a day.
Okay. And
4,000 to 5,000 units a day.
Have you seen anyone in your office that has had just like the most extraordinarily, hand of God, benefit from a particular a particular nutraceutical or botanical that you offered him, like a complete reversal of, X, Y, or Z?
I do see amazing things in my office, Daryl, all the time. I've seen guys on active surveillance who get a follow-up biopsy at some point, and then that biopsy is negative. I've seen people that their PSA rises and rises from a recurrence, and then their PSA stabilizes. Not necessarily goes down to zero. Nothing brings a PSA down to zero, only from a recurrence. Nothing brings a PSA down to zero other than either testosterone or synthetic estrogen. Period. End of story.
Mm-hmm.
Period. End of story. If they take a supplement that it brings the PSA down to zero, that supplement has synthetic estrogen. So that's important to know. Daryl, my work is based, what causes prostate cancer? That's a heavy loaded question, isn't it? Well, genetics. Well, the environment. Well, a bad diet. Well, lack of exercise. Well, a high IGF-1. Well, a lot of inflammation, right? So we can go on and on in terms of what. So in other words, number one, we really don't know. But I think that most scientists would say there's not one cause. So if there's not one cause, why do we think that one treatment is the answer? Right? It's multifactorial, right? So then what we need is a multimodality approach. Let's do several things that work synergistically. So I love science, and I'm a geek as it relates to science. I mean, I'm in PubMed every day looking at scientific research. But just doing that, is not enough for helping patients, because science, using the scientific method, is looking for the one thing to help this one condition, this one disease. So looking at hormone therapy, or I would just look at exercise and nothing else. If exercise reduces the risk of mortality in patients with prostate cancer by 30-40%, and a good diet reduces it by another 30%, and perhaps good sleep reduces it by 15%. And why do we want to segment these? It doesn't make any sense. We want to use as many things as possible. This is a multimodal approach that is so essential. So in terms of, so then once I have patients on, eating better, exercising more, taking some supplements, and sleeping better. Okay, Dr. Gio, what's working? I don't know. What you want to? We should take something out to see what. Okay, so stop exercising, and then eat well, and then I don't know. I do believe in multiple treatments at once, not just one treatment, because cancer in general is a very complicated disease, and there's not one cause. So we need to hit this thing hard, and there's nothing more powerful than proper lifestyle approaches and things like the Capless method, which is a program and a lifestyle program that I put together for prostate cancer. So these type of things are super, super important. So what's the one thing? I don't know. I'll tell you one good thing. I unrelated to prostate cancer a little bit. We all start having a little bit of joint pains as we get older. So even me, I say even me because I don't consider myself old at 47. Get up in the morning and takes about a couple of seconds to warm up the engine and to get going because you're a little stiff. I think glucosamine and omega-3 fatty acids are amazing for that. I take those and I don't have that. So that's just a side note there. Glucosamine, not bad for prostate cancer, not just neutral for prostate cancer, good for the joints. And omega-3 fatty acids, they have anti-inflammatory properties. And maybe curcumin. Everyone should take curcumin, I think.
So finally, we'll end this on the question of disparities. Do you find Black men and white men coming in who are doing hormone therapy present different sets of symptoms and side effects? And do they benefit differently from some of your suggestions around botanicals, nutraceuticals, diet? Go on.
Yeah, I don't see a difference. I do know that African-American men are more predisposed to prostate cancer, higher mortality rate, so on and on like that. But in terms of the treatment itself, I don't see a difference in their risk of mortality after hormone therapy and doing the protocols that I give them. I don't see a difference in how they benefit. They all benefit equally.
Okay. And there's no disparity in what they're presenting to you, like white men saying I'm bothered by this and Black men saying I'm bothered by something else.
No, Black men seem to be more connected to their sexuality. And this is just a clinical observation. So they're more like bummed out about not being able to function sexually compared to non-Black men or white men. And so they get a little bit more depressed about that. They're very much connected, and not every man is somewhat connected to their sexuality, but it seems like Black men are getting more bummed out about it and more depressed about it than white men. That's been my clinical experience.
Okay. Well, thank you very much for this discussion. Everything that you've talked about will be, I imagine, in either your website, your blog, your book, your programs, but certainly in consultation in your office if anyone's ever in New York. Or
telehealth. We're doing telehealth from everywhere. Anywhere in the world now, anywhere in the world, Australia, Spain, it's unbelievable. So drgeo.com is the website if anybody's interested. And there's a lot of free information out there. I take a lot of pride in giving out very good free info. I don't hold anything back. I want to give it all out there. So drgeo.com. The other thing is that I'm most always writing books. A book that I'm working on, well, the PSA book hopefully will be out by the time you release this video. Just the PSA book, everything you need to know about the PSA and why you should stress less over it. Period.
Excellent.
That's the name of the book.
Excellent.
And the other book that I'm working on is a book on integrative medicine book on men on ADT and hormone therapy. So stay tuned. drgeo.com, you find all that information.
Sure. And they could also contact you through New York University Langone Medical Center.
So all those numbers and those emails and everything is all there.
Okay, good. Dr. Espinosa, thank you very much.
Thank you. Thank you, Darryl.
Recording. Stop.